p.m., it starts to look like midnight around here, and you may start hearing more about seasonal affective disorder. To explain what that is and how to combat it, we are joined by Baylor Scott and White psychologist Kenleigh McMinn. Thank you so much for joining us, doctor.
Thank you for having me.
Let's start with defining and identifying seasonal affective disorder.
Seasonal affective disorder is, we kind of think of it as a subset of depression. It's considered a depressive disorder. But what differentiates it from kind of standard typical depression is that it has this seasonal cycle to it. So people who maybe don't experience depression at other times during the year may be more prone to experiencing it during the winter months in particular. There's some research showing that it can happen at other times of year, but winter is really when it tends to be the most prominent. So it's characterized by a lot of the same symptoms we think of when we think about depression. So feeling a lot more sad, or even just kind of a lack of mood, just feeling very blah a lot of the time, not feeling interested in things that normally would be very interesting or engaging for you, not enjoying activities that you would normally enjoy. A lot of people find that they sleep a lot more than usual or are just very, very tired, very fatigued. You might have changes in appetite, changes in weight that go along with it. So there's a lot of different factors that play into it.
So is there such a thing as a treatment for this, or is it just a wait it out?
The good news is that, yes, there is treatment for it. So there are a number of different things that people can do. Sort of one of the gold standard treatments is using what's called a light box. So one of the theories behind what causes seasonal affective disorder is that it has to do with the fact that, like you mentioned, it gets dark outside much earlier in the day. We're not exposed to as much sunlight during the winter months. And that can actually change some of our hormone regulation and some of the hormones that affect our mood, things like serotonin, things like melatonin. And so using a light box is something that is supposed to help sort of reset some of our internal rhythms and cycles. The first step I would say is talking to your doctor about it, because there may be other treatments. They may want to try something like vitamin D, or if you're really, really struggling, things like antidepressants have been shown to be somewhat helpful. You may also want to talk to a psychotherapist, a psychologist, to see if there are steps that you can take to help through that.
All right, Dr. McMinn, thank you so much for your time.
Thank you.